Now, this also brings us to VA disability claims. If you have this type of repetitive low blast exposure, and you have a lot of these TBI symptoms, or some of them, you might be wondering if this can be connected to service. The short answer is yes, but let's break it down. As always, we have to look at the evidence available, starting with the low-level blast exposure. You want to be able to point to documents showing your involvement in these activities. This could be something as simple as the MOS on your DD-214 if you were an EOD, a mortarman, artillery, ammunition specialist, whatever job it is that shows you're involved in this type of activity. Now, I recognize that it's not always your MOS. Your listed MOS could be something different or more general, but you still had this type of blast exposure. Other pieces of evidence could be from decorations you received, where in the decoration itself, it discusses these types of duties that you had. So like maybe an achievement medal where it talks about you participating in this type of work. You can of course submit your own personal statement and any supporting statements from people who perhaps were involved in the same type of activity as you. And all of this is important, but you definitely want to try to find as much official documentation as possible showing that you were involved in this type of duty. Next, we have to look at the diagnosis. If you're noticing that you have a lot or even some of these symptoms, you want to get assessed. This can be at the VA or a private medical provider. Usually you can get assessed by a psychiatrist, psychologist, or neurologist. From there, they'll get your history, discuss symptoms, and do testing with you. This can help establish the diagnosis of TBI and then identify symptoms that could be coming from the condition. They can also help you figure out which symptoms might be coming from another mental health condition as opposed to the TBI. Sometimes separating the two can be really difficult. Now, this is going to help for multiple reasons. It's going to help you get better, right? It's going to help you get the treatment and therapy that you need. And it's also going to help with the nexus or connection between your exposures to these low-level blasts and the TBI itself.